Thank you for renting BodyFlow. BodyFlow has been recommended to you by your surgeon or medical practitioner as part of your post-operative rehabilitation to reduce swelling, thus reducing your pain and facilitating your return to daily function, life and sport sooner. BodyFlow is a unique form of electrotherapy. It is safe, TGA approved and certified. It supplies a mild electric current to the tissue around the affected joint. This stimulation may help in healing by increasing blood flow and removing excess fluid and swelling away from the joint and whole limb. Your leg will feel lighter, less painful, and your muscles will be able to work more effectively. BodyFlow is used globally by surgeons, hospitals, physiotherapists, and elite sports teams. Please remember to take your unit to the hospital and bring it home again, as it is designed to be used from 48 hours after surgery and assists in preventing DVTs.
Do not, however, use BodyFlow until 48 hours initially after your surgery, as it will increase the immediate effects of surgical bleeding. BodyFlow then acts to move swelling and debris through your lymphatic and blood systems once this immediate bleeding has ceased. Also, discontinue use if you have developed or are suspected of having a DVT. Inside the bag, you will find the following: 1 portable BodyFlow unit, 2 sets of leads, 1 red and 1 black, 1 charger, 6 packets of electrodes, the manuals supplied, and a handy tips brochure.
There are some contraindications or reasons you may not be able to use BodyFlow. A representative will have gone through these prior to your rental period. They are also listed in the manual. Before the procedure commences, please ensure that the unit is fully charged. This takes about 12 hours using the mains charger.
A green indicator light will appear on the charger when it is fully charged and ready to go. A red light on the charger indicates that the unit is not charged or still is charging, so let it remain on charge until the red light changes to green.
The unit will need to be charged approximately every 48 hours, or after using about 6 times. An overnight charge while sleeping is the best option, as the unit will be 100% charged. Or, if you run out of battery during the day, a 2-hour charge will provide about 80% capacity. Please note that the unit will not operate while it is plugged into the mains charger.
Now, place one end of each of the red and black leads into the BodyFlow unit. Then attach each other end of the red and black leads into the electrode pad portals. Before placing electrodes onto the skin, please ensure your skin is clean, shaven if required, and dry. This prolongs the life of your electrodes. Peel the electrode pads off the clear mat, ready to place onto your body. There are 2 channels of electrodes, red and black. One colour will run on the inside of the leg and the opposite colour will run on the outside of the leg. It doesn't matter which colour is on which side, but you must never cross the colours. That is, the electrical channels should never cross over. Place the first electrode in the groin area, as this is over the lymph region, and the corresponding colour on the inside of the calf, just below the knee. Place the other 2 coloured electrodes, not directly opposite, but nicely spaced on the outside of the thigh, and then on the outside of either the foot or the calf. If you are unable to access your foot, place it somewhere comfortable just above the ankle, which is fine.
This electrode placement has been shown to be the most effective form of using BodyFlow on the lymphatic system to drain away swelling. As you can see, red on one side, black on the other, and all 4 in an alternating pattern. You are now ready to turn on the unit and begin treatment.
To turn on the BodyFlow unit, hold down the bottom power button for 5 seconds until the screen comes on. The unit will default or automatically choose the standard setting. Press Enter with the middle button to select Standard. You should now see displayed time, a length of 20 minutes. The battery life should be full, but you can now check this to see your battery level throughout usage and determine when it's time to recharge. The two channels are measured in milliamps. Each channel is indicated by a minus and a plus. Intensity 1 is the red channel and intensity 2 is the black channel. To commence treatment, push the plus buttons in both channels up to a point where it is at a strong but comfortable rate. We usually say to where you can just feel and see the muscles comfortably twitching. For some people, it can feel slightly unpleasant at the start, but not painful. Most people find it quite comfortable. As your swelling reduces, you may find you need less and less intensity to reach the same sensation and twitching effect. The treatment will automatically run for 20 minutes. It will switch itself off and reset to 0. If at any point you would like to stop the treatment before the recommended 20-minute period, you can do so by holding down the bottom button for 5 seconds. Stop the device immediately if any discomfort is experienced, and be sure to consult your Bodyflow representative.
The recommended number of daily sessions is 6 to 8. So that's 20-minute sessions for each treatment at least 6 times a day. You will need to change the electrodes every 5 days on average if using the unit as recommended. This is why you have 6 packets of electrodes in your kit. Please ensure that you change your pads, as this allows for optimal current flow and therefore effectiveness of the machine.
Once the unit has been switched off, you have 2 options. The first for when you are resting at home, especially in those first 2 weeks after your surgery and when you're not really up and about. You can detach the leads from the electrode pad portals, leaving the actual electrodes in the correct positions on your body. Then you can simply reattach the leads back onto the electrodes and the unit. You cannot overuse Bodyflow, rather use it as many times as you can during the day. The second option is to simply but gently remove the pads from your skin and replace them carefully onto their plastic mat. This will prolong the life of your electrodes. Loosely wrap the leads of the electrodes around the Bodyflow unit, ready for your next treatment session. Be careful not to pull on the leads, as they can easily be broken. Pop the unit into its portable case for safe storage.
The unit is portable, so when you're on the move in the second week of treatment, you can take it with you to work or wherever you go and continue to use Bodyflow at the recommended number of sessions per day. At the end of your rental period, please dispose of all your used electrode pads, because these are patient specific. Ensure that all components are repackaged into the bag and ready for collection, along with the unit charger, leads and manual. Patients often forget the charger because it's still plugged in, so take a minute to check the wall socket for the charger. A Bodyflow representative will call you to arrange pickup of your unit. If, however, you feel towards the end of your rental period that you would like to extend your treatment, please let your representative know when they contact you. Thank you once again for choosing Bodyflow, and we wish you the best for a speedy recovery.